As the European Public Health Alliance, we support the awareness raising week on alcohol-related harm because this is an issue that we don't think is currently being addressed by European policymakers in the best way that we can. And what we hope is that following this week, we will have a better understanding amongst our decision makers here that alcohol, if treated in moderation, is fine, but if not, then it has a significant repercussion at European level, and we have the power to do something about that. We need an awareness week on alcohol-related harm because the contribution of alcohol consumption and harmful alcohol consumption in the European region is a major determinant of public health problems, of chronic disease, and also wider societal and human harm. The current EU alcohol strategy was an important development in the steps that Europe needs to take towards tackling alcohol-related harm. However, it would be a leap, if you like, if we were to renew this strategy, because this would demonstrate the political commitment that our leaders, that our member states have towards this important issue. Too often we sidestep the contribution that alcohol plays towards costs and human harm in our societies, and this is something that member states at national level have taken various steps towards, and having a renewed strong alcohol strategy which addresses some of the fundamental problems that we have in the European region, which incidentally is the leading global region in alcohol consumption and alcohol related harm, would be a big step forward. We have a surprising number of processes and opportunities at the European level to tackle alcohol-related harm. The reflection process on chronic disease, for example, has the space to look at preventative measures where we know we have cost-effective responses. Wider European processes that support the strategy, the business development strategy of Europe, recognise the importance that prevention and health promotion can play in both reducing costs to our healthcare systems, but also increasing productivity, keeping us healthy and active for longer, for example. And so it's certainly it's not a question of can we do it, it's a question of do we want to do it, and having a commitment from member states, from the European institutions, to use the levers that they have available to them, whether it's the chronic disease reflection process or the research funding under Horizon 2020. These are all policy measures and process measures that can be better used to bring about positive returns to the European economy and to the European population. The burden, the tsunami of chronic disease that is facing the European region is to a large extent preventable, and by tackling lifestyle issues such as alcohol but also tobacco and diet, we are able to offset some of the social problems, the human cost, as well as the financial cost. We cannot afford to be funding an ageing, sicker Europe in the way that we have, and so by tackling the measures that are upstream and preventing us from reaching these outcomes, it's something that will benefit the European economy, and European policymakers do understand, and we have that in our framework documents. We just need to mobilise it. There are a number of approaches that we're not currently addressing properly in terms of reducing alcohol-related harm, and I think that it's time that we move from what are essentially demand-side measures into supply-side measures. So up until now, when we talk about reducing harmful alcohol consumption, we talk about education, we talk about information, we talk about helping people change their behaviours, but actually the evidence shows us that that's not what works. What works is tackling the supply side, so tackling the type of products that are available on the shelves, the cost of those products, their availability, their appeal, their attractiveness, and all of that means tackling financial measures, fiscal measures around alcohol. It also means tackling marketing and advertising, and we are basically at the moment, on the one hand, allowing a free-for-all for the alcohol industry in terms of the supply side, and then asking people to regulate themselves in terms of what they they consume. So if we're pushing on the one hand and actually saying that consumption of alcohol products is good for our economies, which is the implicit message within that, but then we're not taking the cost of that consumption, both for financial cost but also human cost, into account in our economic policies, and also in our social policy. So this is certainly something that I think we can do a lot better